Finally, we asked Dr. Saepoff to talk with us about how she helps alleviate the anxiety some people have about going to the dentist.
In dentistry, because there are procedures being done, it is definitely, at times, there's the potential for it to be very uncomfortable. And of course, there's a nerve inside the tooth, and the nerve can tell when we're doing something out on the surface. Even if we're not drilling, near the nerve, the tooth can feel that. And some people's teeth are more sensitive than others. And let's face it, there's nothing natural about having your teeth drilled. And so there's no reason not to use anesthetic. And a lot of times people are nervous before they come in because they're anticipating what it may feel like. And for people who that makes it even more uncomfortable for them, it's not a good idea to sit there and have all that adrenaline and fear. Your whole endocrine system kind of goes into alert, and it's just not healthy to see, because we're adults, or we're mature, and we overrule it, and instead of running away, we sit there, and then it's doing damage. It's actually not healthy. So I think it's a good idea to be relaxed when you're in the dental chair, and if that means that a light sedation or a little bit of nitrous oxide, just so that you don't have that biological response going on, that is going to be a much nicer appointment, and you're not going to be exhausted afterwards. When it comes to pain management, I want to find out right off the bat what exactly that patient has concerns about. If there was a way that a dentist did something in the past that created anxiety or caused pain, I will make sure I communicate to that person how I'm going to do it differently. And that way they don't have that anticipation or the fear associated with it. And I will combine light sedation and anesthetics with a gradual approach to the procedures. We'll do one tiny thing one day so that they get an idea of how we work and who we are and the level of communication that we have with that person. And then on the next visit, they can maybe do a little bit more, or another small one, or maybe they want to just go ahead and get a few teeth over with because now they know how we do things. So we combine working with that patient's memories and what they bring in with them to that appointment with whatever medications are helpful for them, and we try to keep it as minimal as we can. Most patients who want natural or holistic care or have that lifestyle, they want to be alert, they want to be at choice, they don't want to be drugged, so that they don't know anything or remember anything. Some people do want that, but most people who live this lifestyle, they really want to be conscious and at choice, and they just want to be able to choose really what's happening. And I make sure throughout the appointment that that patient is still what I call at choice. So we stop and we say, okay, we have a conversation. Is there anything about this, or this is okay? Can we change how I'm doing something? Just to make sure that all the way through the appointment that they are still willing and choosing what we're doing.
To me, natural dentistry is a holistic view of care where she's considering your whole body and not just your mouth.
Natural dentistry is the use of the least toxic materials in the most advanced technical ways. But unfortunately, most people don't know that there's another choice. I think that you need to be educated.
We actually chose to come, even though we live an hour and a half away, because we really appreciate her services. It's what we value in a dentist. She's caring and has a great touch technically. She's very intelligent, understands her industry and the dentistry work, and is always looking to be on the forefront of new and exciting advances in dentistry.
And I've had probably 10 dentists in my lifetime. I don't flinch thinking about coming to the dentist.
I am hopeful that by speaking out about alternatives, that people find out about it and begin to learn about it and begin to ask for it, and that dentists begin to respond and look into it and see how they can turn a little bit toward this and accommodate people who are requesting more natural and more conservative options.